Abigail Brown was just 3 years old when she developed Rocky Mountain spotted fever following a tick bite a few weeks before then. She wrote that she was put in a drug-induced coma for a week. And when she woke up, she said, "My muscles were tight. My arms pulled up to my body. My legs were rigid. I could not move, talk, or swallow." She gradually regained the use of her left hand and learned how to walk again, but she never recovered her ability to speak or to return to normal. It was only when she was 5 years old that she said her parents learned that she was manifesting the features of dystonia arising from brain trauma. She remarked that dystonia greets me like an unwelcome guest each morning. Tightness starts running through my body without my permission. Brown wrote about her experience in her memoir titled Unstuck, a book she wrote entirely by typing with her left thumb. Hello, I'm Ibrahim Imam and welcome to this episode of the Neurology Lounge podcast, which will address the theme of dystonia, one of the most distinctive neurological manifestations and yet one of the most nebulous to pin down. Dystonia typically presents as sustained contractions of muscles, typically as twisting and repetitive irregular movements which result in abnormal posturing of the limb or body. The movements may be set off by voluntary action and they may be quite painful. A curious feature of dystonia includes mirror movements, and that is the flow of dystonia from one limb to the opposite one. There's also what is called overflow dystonia, whereby dystonia spreads to adjacent areas. Dystonia may also manifest with diurnal fluctuation, tending to vary in severity with the day, a helpful clue to the diagnosis. Another less specific pointer to dystonia is alcohol responsiveness, a feature of other movement disorders such as essential tremor and myoclonus. Part of the diversity of dystonia is its ability to manifest in focal or generalized forms. The most common form of focal dystonia is that which affects the neck muscles, called cervical dystonia. An illustrative case of this was narrated by SE Aho in her memoir titled Conquering Dystonia. Aho was chatting with her teacher in class when she slipped on a slice of cucumber. She felt that she hurt her shoulder as she caught herself on a desk. She experienced a tight, full body feeling, and the next day she said, "My body began to quiver just a little bit." She had physical therapy to relieve the pain in her shoulder, but she said the shaking then got more intense. She added that at first it was just in my neck. I was walking with my head turned to the left. I hardly knew I was doing this. As time went on, she said, my neck bobbed like I was saying yes to everyone all the time. She wrote that the agony was intolerable and the shakes were getting stronger, adding that my muscles were fighting non-stop. She started pushing her hand up against her head to keep it steady. And by the time she saw a neurologist, she said my head was tilted to the left and my ear almost touched my shoulder. By this time, the dystonia was also affecting her voice. She said people found what I was saying incomprehensible. And soon after, she noted that the shakes extended to her right leg and her spine. She said my leg would jerk wildly and suddenly it would merely bounce. By now, Aho's dystonia had generalized to include laryngeal dystonia. A different and perhaps more intriguing form of focal dystonia is the type that emerges in people who play musical instruments, so-called musicians' dystonia. An illustrative example of this is the case of Aurelian, and this was narrated by Coralie Cousin in the memoir titled The Day My Hand Stopped Playing. Aurelian is a professional pianist who started playing the piano when he was just 6 years old. And by the age of 20, he said, I was earning a living from what I love to do, all the while continuing to practice for 6 hours a day. It was when he was 34 years old that Aurelian said he started to feel some discomfort in his right hand when playing the piano or using the computer. He then started to lose strength in the hand, and one day he said, I lost control of the fingers of my right hand at the piano. Describing what happened, he wrote that one finger lifts up, the other folds under. My hand stiffens, locks up, and stops playing. He added that I can play certain fast runs, but I cannot play through a Mozart sonata anymore. I cannot play certain fast passages. My hand just stops playing. He went on that while playing a fast run on the piano, my fifth finger folds into my hand and it curls up into my palm, pulling my fourth finger with it, as if I was simulating a gun. His lament was very striking when he said, I'm losing feeling in the fourth and fifth fingers of my right hand. I'm losing grip. When I play, I can't feel my fingers. It's as if the muscle memory of my fingers has stopped functioning. The more I play, this loss of sensation increases to the point where I cannot continue. My hand loses its stability. I lose control of my fingers. With time, he said, I turned down concerts, summer festivals. I'm becoming increasingly isolated from the outside world. Not being able to express myself through my hands is like having my tongue cut off. Aurelian eventually saw a neurologist who was renowned for his expertise with musicians and who recommended a treatment program that enabled Aurelian to eventually return to professional piano playing. Another dimension of musicians' dystonia was narrated by Apostolos Paraskevas in his memoir titled A Classical Guitarist's Story of Recovering from Focal Dystonia. Paraskevas wrote that he felt a vague weakness of his right hand a day after he presented his fourth concert at Carnegie Hall. He said, on that night I performed 3 of my own guitar concertos, both slow and chamber music, and that it was a long program, but all went well. A few days later, however, whilst teaching a student to play a musical piece, he said, suddenly I realized to my dismay that something was severely wrong. I couldn't move the fingers of my right hand freely, and my ring finger was curling in toward my palm. He said, this was the most frightening feeling I have ever experienced in my career as a classical guitarist. Musicians' dystonia is just one of a variety of task-specific dystonias. These are abnormal movements which develop during the performance of highly skilled tasks and may be preceded by an initial feeling of tightness and fatigue. The movements typically impair dexterity and there may be associated tremor in the affected body part. Included in the class of task-specific dystonias are such disorders as laryngeal dystonia, writer's cramp, and task-specific cervical dystonia. It also includes runner's dystonia, dealer's dystonia, and even stepping on the brakes dystonia related to driving. Apart from traumatic and task-specific cases, dystonia may also be acquired in other ways. For example, the disorder can be triggered by stroke and by infections such as viral encephalitis, HIV, tuberculosis, neurosyphilis, and subacute sclerosing panencephalitis, or SSPE, which follows measles. And apart from the acquired forms of dystonia that we have explored so far, dystonia may also be an inherited condition. Such was the case with Brenda Currey Lewis, who narrated her illness story in the memoir titled A Twisted Fate, My Life with dystonia. Lewis was 7 years old when she said, I started to experience odd, intermittent difficulties when walking, and soon I was walking on the outside of my foot all the time. And within a year, she said, my right arm and leg were twisting and pulling, and my right foot arches and turns onto its outer edge. She added that my hand is cramping and clenching while my arm is pulling behind my body. And when sitting, she said, my right leg pulls up towards my chest at an odd angle. Later on, the movements and odd posturing began manifesting in her left foot. She started to lose her balance and fall, partly because her pelvis protrudes forward when walking. Lewis further described the distortions that dystonia imposed on her when attempting to use her wheelchair. She said, my torso is twisted and my left hip continually straightens and twists inward. Therefore, my left leg refuses to stay on the foot pedal of my wheelchair. She added that my leg demands to stick out to the side, whether I am sitting or standing, and ultimately gets its way. My left knee needs to straighten too, and my foot clenches quite vigorously most of the time. Quite distressing. Unfortunately, her sister Tricia also inherited the same dystonia and manifested it even more severely. There was also a distant paternal relative who had the same condition, who she said had an awkward gait and walks with a cane. Lewis was eventually diagnosed with dystonia musculorum deformans, an old name for a primary form of dystonia. She said, I found out years after high school that my father and grandfather felt twinges of guilt because dystonia had been passed through their DNA. Once the diagnosis was made, she said, the disease progressed very quickly. Importantly, however, Lewis observed that while living with dystonia, you will often find a relief mechanism. She explained that this means that you can find a position or a certain movement that will allow a symptom to cease, although the sense of relief is fleeting. In her case, she said, the position is to elevate my straight left leg and rest it on an object about the height at which I am sitting or higher. Lewis is describing what neurologists call jest antagonist, little actions that people with dystonia have learned can relieve or sometimes even abort their dystonia symptoms. The type of inherited dystonia that Lewis has is also called torsion dystonia and is caused by a mutation in the DYT1 or the TOR1A gene. It is important to know that the number of these DYT inherited dystonias now counts about 35. Apart from the DYT forms, dystonia may also be inherited in other genetic disorders. And this is the case with Mark Dendy, as narrated in his memoir titled The Cascade Effect. Dendy wrote that he had always been accident-prone from childhood. And by the time he was 24, he said he had become clearly uncoordinated and was having difficulty maintaining his balance. He then started to drag his right leg, and his whole body and head began leaning to the right. In addition, Dendy also experienced hand tremors, so much that his colleagues at the stables where he worked started calling him shaky. His tremors progressed very rapidly, and he said, within 1 month, my walk became crippled. To add to these difficulties, he started exhibiting severe mood swings and suicidal thoughts. For example, one time he said, I was singing, laughing, and having a blast when I suddenly had the urge to jump off our 5th floor balcony and end it all. As his condition worsened, he started having what he called uncontrollable wing flapping episodes, which are followed by outbursts of anger and tears. By the age of 27 years, he said he needed help to even button his trousers and tie his shoelaces. It was shortly after this that he was assessed by two neurologists who diagnosed him with Wilson's disease, a disorder of copper metabolism whereby copper accumulates in several body organs. Dendy explained that Wilson's disease was first described in 1912 by neurologist Samuel Alexander Kinnear Wilson, who reported on 4 patients with the disease. Dendy also noted that Wilson's disease is also known as hepatolenticular degeneration, and this is because it prominently affects the liver and the lenticular nuclei in the brain. These nuclei consist of the globus pallidus and the putamen, for those anatomically minded. Apart from a liver specialist, Dendy was also seen by an ophthalmologist who, he said, gave me a thorough eye examination and said that in his slit lamp exam he noticed that I had copper color rings around the irises of both eyes. The ophthalmologist told him that these were Kaiser Fleischer rings and that they were diagnostic of Wilson's disease. The presence of tremor alongside dystonia is well recognized, and it is called dystonic tremor. Dystonia may also present along with other movement disorders such as myoclonus, chorea, and athetosis. And apart from depression, dystonia may also be accompanied by other psychiatric comorbidities such as anxiety, obsessive compulsive disorder, alcohol dependence, and social phobia, perhaps understandably. The bedrock of the treatment of dystonia is botulinum toxin injections. For example, Aho saw a movement disorder neurologist who treated her cervical dystonia by injecting her right shoulder and neck muscles with botulinum toxin. The relief she got from Botox, however, was short-lived, and she eventually stopped responding altogether. This prompted her to explore deep brain stimulation surgery. She wrote that the relief was enormous and it felt as though my life had been granted another lease. She also found physical therapy, acupuncture, and biofeedback helpful. The various treatments of dystonia are also portrayed in the account of Lewis, who wrote of such interventions as baclofen, benztropine, artane, and botulinum toxin. She was also prescribed Haldol, Tegretol, Rivotril, Dilantin, Sinemet, Valium, Dalmane, Clonazepam, and Ativan. She said nothing seemed to make a significant difference. She eventually had the brain operation called thalamotomy, and this is lesioning of the thalamus. But any benefit she got from this was only transient. And at the third attempt at this operation, she unfortunately suffered a stroke when the surgeon damaged a blood vessel. Amongst the complementary treatments Lewis underwent were physical therapy, massage, acupuncture, walking casts, foot braces, and hip adductors and Achilles tendon orthopedic operations. Brown also had botulinum toxin injections, and when this failed, she also went on to have deep brain stimulation. Dendy's account of his treatment closely mirrored the chronological advances that have been made in the treatment of Wilson's disease. Apart from a low copper diet and antidepressants, he was treated initially with penicillamine. He, however, developed abdominal pains on this treatment because, as he explained, penicillamine could lead to toxic levels of free copper. For all these reasons, he was moved on to zinc sulfate. He remained on this for 10 years, but he eventually became intolerant to zinc as well. He was then transitioned to trientine, a new treatment of Wilson's disease at the time. To explore the patient perspective of dystonia further, I will be speaking to Tom Seaman, author of the book called Diagnosis Dystonia, Navigating the Journey. And this will be in the next episode of the podcast. Thank you very much for watching or listening to this podcast. If you found it enlightening, why not click on the like button? And better still, why not subscribe to the YouTube or Spotify channels of the podcast? And whilst waiting for the next episode of the podcast, check out my book called Surfing the Brain, and you might also want to browse my Neuro Checklist website. Thank you very much for your time.